Hi there, this is the last of your lecture series online video of Unit 1, and I wanted to cover contraception. Now, I am not going to assume that the audience has prior experience. So, with that said, I'm going to go over basically very basic contraceptive methods. And I can, read it to you and you could just easily read it yourself. But I'd like to highlight some items here that you may want to need to know. Now, remember, go over your NCLEX questions, contextualize them in an NCLEX question that we talked about, and see basically what's important to know. Because as you know, in nursing school, you can memorize everything and still not know anything, right? You feel like, what? I don't even know what's important. What's going to prioritize your information and contextualize your information is not only reading the book, but reading the NCLEX questions. Because then it tells you what's important to know and how to apply it and how to prioritize. So let's look at the different types of contraception. I like tables, what the client is involved in, advantages, pluses, minuses, and risks. A lot of this stuff, I taught this for a long time, that the students are, they say to me, are pretty familiar with the information. And I'm here to just give the basic information. There's so many products out there that we're not going to talk about products. We're going to talk about just the basic generic information, okay? So as I go down the list, you're going to say, oh, I've heard of that, I've heard of that. But let's just also just spell the wives' tales, or what grandma said to you in Minnesota. So first is abstinence and no exposure to sperm. Now, I just want to say, even before we talk about contraception, did you know, we talked about it before in prenatal, 50% of all pregnancies are unplanned. Not saying that your mom and dad didn't want you, but they're unplanned. So I'm sure they still love you anyway. Abstinence, as you well know, requires a lot of self-control. I can put it in a storyline. There tends to be no risks, although we do talk about a little bit in prenatal and labor and delivery and a little bit in NICU about domestic violence. And that's a whole new category we can talk about later, that we say no is supposed to be a complete sentence, but sometimes it is not for the partner. So that could be a risk in a sociological point of view. It tends to be most effective in that STIs are not transmitted, and we know that. Coitus interruptus is most ineffective because it requires a lot of self-control and there's leakage. So that withdrawal method is not really a good idea to use. Could be an option for religious reasons. The rhythm method, pros and cons, you're thinking, well, see, the rhythm method, doesn't it supposed to be where the woman has to know her cycle? She has to be pretty regular. And we're saying if the rhythm method is you choose to use, that no exposure of sperm, that we said, no exposure for what, anywhere from 3 to 5 days, because the egg only lasts for 24 hours, but sperms can live up to 3 to 5 days. So that is where is for the point of avoidance of pregnancy. She needs to avoid that, and he needs to avoid that period of time. It's most useful in a combination of methods. It's inexpensive and convenient, no side effects. But again, we talked about she must be very regular. Even if she's trying to make sure she's regular, you can see in the book, I always refer to the book, she has to have a regular menstrual cycle and to make sure she's fertile and know the fertile period. She takes her basal body temperature. She can check her cervical mucus for ovulation detection. Her symptothermal method, which is she takes her temperature. I mean, the list goes on, and that is why sometimes majority of women are not regular, and this tends to be not that successful. So the majority of women are not regular. What else do I have to say? That it affects definitely the menstrual cycle, and to see how regular she is. So it does require abstinence, and we kind of refer to that as self-control. That can be a disadvantage. There are a number of mechanical barrier methods, spermicides, needs reapplication for each exposure, and we have to educate, especially teenagers, that spermicides are not a form of decreasing STIs and or HIV. And sometimes they don't know that. We may assume that, but we always make sure when we teach teenagers and even other people that they may not know that it does not decrease the HIV or STI growth at all. Condoms must be placed properly. They are very portable. However, there's sometimes nice non-compliance and reduced spontaneity. It does protect against most STIs, but not all, and that's again something we must educate the partners for. It does not protect against all STIs and HIV, and it involves the male. The point that we say this in the book is that sometimes females complain, well, what are the males going to do? We have to do everything. So condoms are typically a good choice. Be careful leakage, breakage, things like that. Allergies. Diaphragms are useful. However, women complain that a nest needs to be fitted by a healthcare provider. So she needs to get an appointment, and she must get one fitted prior to pregnancy, and she must be refitted after she has her baby because the cervix can change in size. No surgery, more female control. No, perhaps you might want to say no males involved, but I can't assume that. Inconvenient for some. Spontaneity is reduced. You can have a history, what we call a toxic shock syndrome, because it's involved with staph or strep, and in more higher incidence of UTI because it's pressing on the urethra. I teach moms that always after exposure of sperm and or sex, she must go to the restroom because going to the restroom helps to decrease UTIs. Cervical cap is similar. It's just a small, almost looks like a small diaphragm. But the advantage of the cervical cap, let's see over here, I didn't even have it. It's more occlusive. It just covers the cervix. And so it's a lot more occlusive. We don't have to add additional spermicide. Might be a little inconvenient. And again, there are risks for infection and cervical dysplasias. So I would say, and make sure you look at the pictures in the book, that there's an advantage to the cervical cap because you don't have to add more spermicide. This must be applied for each time of exposure because it's so big. But because it's occlusive, we don't need to put more after each exposure, put more spermicide. Okay, contraceptive sponge that's not typically sold in the US because of problems with toxic shock. However, it's very popular in Europe. But obviously, it's probably convenient, one size fits all, but we are definitely worried about toxic shock syndrome. Hormonal methods tend to be the most popular. Not only the progestin only, but the combo pill. Combo pill tends to be the most popular combination of estrogen and progestin, and the pill, is most common. We can have all different types of via delivery, injection, transdermal patch, vaginal rings. I mean, there's a plethora of products out there. And the huge advantage, of course, is very highly effective, 99.9%. They really like it. Most women prefer the pill over the patch, over the injections and things like that. It does not reduce, you need to educate your mother, does not reduce STIs, there's multiple side effects. If you open up the circular on the combination pill or the packet of the contraceptive pill, you'll see a huge list of side effects, namely bolded uppercase is blood clots and cardiovascular involvement. So that is not really advisable if she has prior cardiovascular involvement, such as maybe perhaps heart and or diabetes. So it's only prescription only, and that is, again, in the political world, it's debatable because we, as some women are concerned about availability, because is it safe? Do we need to go to a health provider? And these are all the things that you need to ask yourself. Why can't they be over the counter? So it's still up in the air. There's no firm decision on that. As I was talking about here, that is the major problem with cardiovascular problems, involvement with the pill, combination pill. The advantage of the progestin only pill, which does not have estrogen in it, she can breastfeed because estrogen dries up the milk. So you do want to tell moms that if she decides to breastfeed after having a baby, she needs to use progestin only products, whether it's the Depo-Provera pill. There's tons of implants out there. The newer ones are coming out. But that is, she cannot use her combination pill with estrogen if she wants to breastfeed. So it's less effective and can cause scarring, which a lot of women do not like from the implants. Emergency contraception, yes, there is debate about that, but it needs to be taken within 72 hours of exposure. Some of the complaints are nausea and some abnormal bleeding. Lastly, we're getting over here to IUDs, intrauterine devices. It's chemically active T-shaped device inserted into the uterus. So they have copper. They have many different devices. We're looking at all this generically speaking. And, usually pretty effective. Maybe for some women up to 10 years. But we had one story where the baby was born cesarean section and the baby had the IUD in his hand. So obviously that didn't work. Everyone had a chuckle in that OR. The problem with IUDs, as you can see, it can cause bleeding, perforation, PID, pelvic inflammatory diseases. So there are some disadvantages to that. And lastly is sterilization. Although, if you look at the picture in the book about sterilization, bilateral tubal ligation, there's been women having babies after a tubal. And nobody knows why, because how a tubal, if you see one, how a tubal is done, we go intra-abdominally and they sever or ligate the tube, they cauterize it, and they tie it. And everyone says, well, how can that be? How can she get pregnant? And we don't know. So there's problems with ectopic pregnancy that we'll talk about in complications later, but these are when the products of conception, the fertilized egg, goes somewhere else and implants. So we're worried about that. Not common, but can happen. And lastly, another male involved contraception besides the condom is the vasectomy. Ligation severance of the vas deferens. And that can be outpatient. It's a little cheaper, a lot less invasive than the tubal ligation. So I think with all that, we're going to see this is sterilization, this is post-op care. And our purpose as healthcare providers is to educate them the pros and cons of many choices, and education is very, very important, and then actually dispelling the myths. All right, look at your book, look at the pictures in the book. I usually show a PowerPoint of the pictures, but they're the same ones in the book. Alrighty, thank you, and that's the end of Unit 1.